right. So before we begin, we're gonna play a video by uh, uh, someone called Nola John. She suffered an amputation several years ago, and we're just gonna do an interview with her so she can tell her story. All right, so we're gonna do an interview by Miss John.
Good afternoon, everyone. I am Desiree Nelson Winley, and with me is Nola John. And this afternoon, we are going to be chatting a little about diabetes and amputation. Nola is going to share her journey as a diabetic, as an amputee with us. Nola, welcome and thank you so much for accepting the invitation to be part of our session. Let's talk diabetes and amputation.
Thank you for having me.
Nice. Let's jump straight into it. Tell us a little about who is Nola.
Lola is a household name in Tobago. Definitely, especially in the community. I'm like a mother, a friend, you just name it. Whatever I could be, that is who I am to the people of my community. I'm loving, caring, sharing, and that part is a gift from God. It's not from myself. It is a gift from God because God is love. So I am loving.
Right, so Nola, we said we're going to be talking this evening diabetes amputation. My first question to you is how long were you diagnosed with diabetes?
I've been diagnosed since 1992 with diabetes.
Okay, so that's more than
About 30 years,
30 years.
roughly.
Okay. What did you know about limb loss at that time?
Well, I all time heard about you could lose your limbs, it could affect your organs, and all these things. They affect the furthest part from the heart and all that kind of thing.
Right.
Unfortunately, I lost my leg,
Okay.
and losing your limb is not an easy ride for some people because we are moving from a mobile situation to an immobile situation, and not everybody could adjust to that.
And we will talk a little more about your transition as we get further down into the interview. What was your first sign of infection?
Well, my infection had different stages
Tell us
because
about it.
because I could remember a Saturday night I came from playing netball and I observed my white socks had bloody fluids onto it. As the night grew older, the pain get more excruciating.
Okay.
So the Sunday morning, I did go to the hospital, and there and then is where I discovered that I am diabetic. That
Okay.
was just a slight infection. I had a leg infection that caused me, almost caused me my leg, my right leg. Thank God for Dr. King, deceased, and thank God for Nurse Charles, also deceased. Nurse Charles dressed this leg for 1 year until it healed. This leg had down to worms. The other leg, like it had a particle in there on our way to me and on our way to the nurses and the doctors. I used to go to the Canaan Health Center for dressing Monday, Wednesday, and Friday. And no improvement. I was hospitalized for 3 months. And it didn't get better, it got worse. The part that I didn't want to hear is when Dr. Bell told me, Lola, there's nothing else we could do for you with this food. We have to take it. I accept things very easily.
Okay.
I turned to him. I said, if you could carry me to cut it, you could do it now.
Okay.
That was my thinking. I called my children. I said, I'm going to do something. I want nobody come next to me crying. And lo and behold, my leg was taken because the infection was so bad. I couldn't eat, I couldn't drink, vomiting black, can't raise up and bleed till I can't even help myself. So thank God, I just like myself, like a mango. You know when mango coming in season, you're thirsty to have a mango. Well, I'm the birchuk mango. I am the birchuk mango. I cut out the birchuk,
Okay.
and I had the balance of the mango to use. That's it.
So, from what we just spoke about, I am seeing that it's important for diabetics to inspect their feet. But you're saying that you did not know that you were diabetic. It's only when you realized what was happening to your feet and you went to the doctor, you were diagnosed with diabetes?
Yes.
So this will take me to my other question. We start talking about your transition as an amputee,
Yes.
right? Can you describe your experience as an amputee and how has it affected your daily life?
As an amputee, it did affect my life. Although I accepted it, although I used to go back to the hospital and encourage people to take the leg, some listen and survive, and some harden the ears and they die. It's not easy because remember, you do everything basically for yourself, you depend on nobody. But when you lose your leg, you have to depend on family members, neighborhood for assistance. Because when you could run outside, if you have clothes hanging on the line, rain coming, and you take them off, you can't do that anymore. So you need family, you need the community, you need people in your life that would be an asset to you.
Yeah.
Also to encourage you along the journey. That's how I see it.
And I know now you're an amputee and you have been going out, as you said, sharing and encouraging others. Right? I know that you are part of the Tobago Amputee Support Association.
Yes, I am.
And you have been doing good work, despite your limitations.
Yeah.
You have been a source of encouragement and strength to other persons. And I know you have always been sharing with those people how you would have successfully traveled and transitioned, into this new journey, into this new life, having your both feet, yes, your two legs, and now you will have lost a limb,
Yeah.
using a prosthesis, but you have not allowed that to stop you.
No.
And as our motto says, as the Tobago Amputee Support Association, losing a limb is one thing, but journeying on is another. Your will to survive is another. And I really want to commend you on using your disability to help motivate others. Yes? And as we look to round up on our interview, do you have any advice to persons who are living with diabetes as well as who is an amputee? What would you like to say to these people?
I would say, number one, people living with diabetes, take care of yourself. Check your feet daily. Do not walk barefooted. And all these things, they are hazardous to your health as a diabetic. If you have a a little injury, go to your health center. Don't stay at home and play doctor, play nurse until the wound deteriorates. Seek medical help first.
Yes.
I also want to encourage persons with diabetes to take care of themselves by controlling the diet. And also, amputees that have lost a leg to avoid being a double amputee also. You watch what you eat, you inspect your feet and all this daily or every other day. Take care of you.
Lola, I am really happy that you would have been able to share your journey with us this evening. Very informative, and I really hope that from what you would have shared, that persons who are viewing this interview would learn something from this interview to improve their lives as a diabetic. I wish you all Godspeed, and I want to encourage you to continue to take good care of yourself. Yes?
I try
Thank,
by God's grace.
yes, thank you again.
Right, so I want to say thank you to Nola and to Desiree and also to Michael who did the recording for the information that was presented. I hope it was informative and that there's something that you can share with others so they can heed her advice so don't go along the same road. All right, as we continue, our presenter for today is Dr. Alimaya Chadband, who grew up in the village of Black Rock, Tobago. He is the son of Martin and Beverly Chadband and has four brothers and one sister. All right, he would have attended the University of the West Indies, where he had a bachelor's degree in surgery, and he also has a postgraduate diploma in family medicine. He currently works in the community, has a private practice in Blackrock called Optimal Health Services Limited, which includes a social and family-oriented entertainment center called Real United Entertainment Center, the only health facility of its kind in Tobago. He currently attends the Blackrock Seventh-day Adventist Church and has been a leader and teacher of the church's sign language group, which many of us know called Songs of Silence. He loves the Lord, and we are happy to have him present to us this afternoon. But before he presents, just want to just a reminder, so please keep your mics muted. If you have any questions, you can place them in the chat. And at the end of his presentation, we will have time for answer those questions that are placed in the chat and any of the questions that may be asked. So Dr. Chadband, thank you for agreeing to present today, and it's over to you.
Thanks, Dr. Waldron, for that introduction. I really liked it. You didn't make any mistakes there. Right, I want to thank AHPA for inviting me yet again. I'm seeing a lot of persons online, which is good because this is a very important topic for us all, right? So let me just try to share my screen here. Right, so you all can let me know if you're seeing the screen.
Yes, we are.
Great. Nice. So we're going to deal with preventing diabetes-related amputations. Very important topic. So some of the things that we hope to achieve at the end are an understanding of what diabetes is, just a basic understanding, how it affects the vessels and nerves, the signs and symptoms.
Sorry, Dr. Chadband, to cut here. We're seeing your slide as well as slides on the side. I'm not sure if you are in presentation mode.
Just How is that now?
Yes.
Okay, great. Sorry about that. So objectives that we intend to cover today would involve just a basic understanding of what diabetes is, how it affects the vessels and nerves, the signs and symptoms of diabetic foot disease, and what measures can we use, if we have a typical diabetic foot, right? And of course, we want to prevent diabetic foot amputations. So what is diabetes? So persons would hear the term diabetes, and a basic understanding of it is it's really a very sustained high level of sugar that is within the blood, or glucose, right? So normally if it is you eat, your body would be able to bring down that high sugar from the insulin that it produces. However, with diabetics, there is a problem with insulin. That's the problem. The insulin is created by the pancreas, which is a very important organ in our body. But with diabetics, it's either the insulin has a problem with functioning, or it's just not produced in the capacity to really do the work of reducing the sugar in the blood. So just a little literature. If we were to go to the first world area, research shows that in the USA, 80% of lower limb amputations are a result of complications of diabetes. 80%, that's very high. And let's contrast it with the Caribbean. Now, there was a journal, the World Journal of Surgical Procedures, that was done in 2019. I'm just moving this screen. Right, lovely. Right, in 2019, and it stated in the Caribbean, the reported annual incidence of lower limb amputations in persons with diabetes ranges from as low as 54 per 100,000 persons per year in Trinidad and Tobago, and as high as 936 per 100,000 persons per year in Barbados, right? And that's ranking among the highest in the world. So there are different reasons that the journal stated for this. Some persons didn't have enough education. They didn't probably have the finances to have, a proper diet. Some persons were not compliant with their medications. They never used to check their feet. And all of those are examples that were given for why these figures are the way they were. Now, there are some real risk factors for diabetic foot complications. Uncontrolled diabetes. So this is very important because you can have diabetes, but it can be well controlled, meaning your values are not too high. There's something called your HbA1c as well, which really is a measure of how well your sugar is controlled over the past 3 months. It's a very important blood test that we do as well to help with the monitoring of diabetic patients, right? So for diabetics, your HbA1c should be 7% or below. No, if you can get it lower than that, even better, right? So that's what we're talking about. When we're talking about control of the diabetes, we're talking about not having your sugar levels spike too high. And control would involve, of course, eating properly, exercising, being compliant with your medications, meaning taking your medications if you have them, and attending clinics and your follow-ups. All of those would help you to ensure that your diabetes is well controlled, right? Overweight. If you're overweight or obese, that could also pose some problem where you can, the risk of developing diabetic foot complications would be higher, right? If you have high blood pressure, high cholesterol, if you smoke, and if you drink alcohol. So how do you keep your feet healthy? I was listening to the video before, and the lady who was interviewed, she gave some very important tips that we should be mindful of. So we need to look at them every day. Every day, that's right. So if it is you, there's somebody living with you who could help you look as well, that would also be beneficial. If not, for instance, if they are not at home at the time, you could also use like a mirror and check your feet. Very important. You check below, you check around, you check between the toes, right? As a diabetic, you need to be very aware of what your foot looks like and if there are any changes. Once there's any kind of change at all, you should get a medical consult, right? See a doctor or see someone a medical professional who could guide you accordingly. Don't walk bare feet, and this involves indoors. I do have some diabetics sometimes, and they tell me, well, you know, they like to walk barefoot, but that's a very bad practice for a diabetic. And as we go through the presentation, we'll get a better understanding of why, right? And even indoors, you want to get probably have on a slipper, and there are those lovely, comfortable, padded indoor footwear that you can have as well. Dry between the toes, very important. After you are bathing, you want to ensure that you carefully dry between the toes, not very rough where you can cause little bruises and cuts, right? Proper footwear. Your footwear should not be too tight, right? Tight footwear is a problem for a diabetic, especially if you are an uncontrolled diabetic. So one of the pointers that we can give for persons who are looking for shoes, for diabetics who are looking for shoes, is we suggest, you know, you can go trying on shoes later in the evening. And why? That is because after you've gone through the day, you know, your feet would become a little bit more swollen. So that's actually a good size for you to use now to try to get a footwear, as opposed to if it is you go early in the morning when your foot is a bit narrower, then you may buy a shoe and basically your foot might swell and cause a lot of friction within the footwear, right? So if it is you're going to try on shoes, it's best to do that in the afternoon. Cut your nails straight across, right? I know we like to do those lovely curved nails, but it's important that we cut them straight across, and that's to prevent like ingrown nails and so on. Because if you cut them down, you run the risk of developing infections if the nail gets into the flesh. Don't remove corns or calluses yourself. Very important as well. I know we tend to like to do a lot of things on our own, but for diabetics, we have to be very careful, right? Corns and calluses, it's best to have them removed by a medical professional. And there are many reasons for that, and you'll learn about them as we go forward. Regular exercise. Exercise is good, always good. For persons who have diabetes, for persons who don't have diabetes, exercise helps with our general health and well-being. It would help to bring down the sugar levels. It would help with the health of the blood vessels, which are important as well. And again, you'll learn more about that. And get your feet checked at clinics or your checkups. Don't miss your checkups and your clinics. Good. I know some diabetics may be well controlled and they're just on their diet, which is very good. But you should still have a checkup, whether it be once every 6 months, to have the medical professional just review you, and also to do your basic blood work. Now, that not all persons might be controlled on just the lifestyle. Some persons have to do lifestyle measures, that is your diet and your exercise, plus they may have to get certain types of medications, whether it be in tablet form or insulin, which would depend on how elevated your sugar levels are and how your normal bodily insulin function is. So when we're talking about the diabetic foot and we want to talk about complications of diabetes, there are certain things that we need to understand or Foot has vessels and nerves, and if there are any problems with these, they can cause certain changes in your feet that can eventually cause problems and later down lead to an amputation. And once we are able to identify these early, then we would be on our way to preventing any amputation. So take a look at this photograph. I think it gives a good picture of some of the problems that a diabetic may experience, right? And in the picture actually gives you problems where somebody with abnormality with the arteries might suffer, the veins, or even the nerves. For instance, check the first one. It says tingling, burning, or pain in your feet, right? So if it is you're feeling something like that, you should also see your doctor, right? So that means the nerves are affected, right? We want to catch these things at the earliest point in time so that they don't progress to worse cases. The second one says a change in the color and temperature of your feet. Sometimes your foot or your feet could look very shiny, right? And there's lack of hair. All of those things would point to you having some kind of problems with your arteries. And then sometimes they can look swollen and they can look red, right? They can also get warm, right? Which could point to things like your veins being a problem or if there's any underlying infection, like what we would call a cellulitis. Good. Dry, cracked skin on your feet, right? So if your foot is very dry, then it raises the chances of you getting like an ulcer or any breaks in the skin, which is raises the potential of you developing an infection in those areas as well, right? Loss of feeling or ability to sense heat or cold. Again, another problem with your nerves. So if you can imagine if it is you have, let's say some persons have diabetes for a very long period of time, some of them for whatever, well, not for whatever reasons, for different reasons, such as they may not take their medications or they don't take it on time or they miss clinic appointments, they don't follow some of the guidelines, then their diabetes become uncontrolled and over a period of time, it affects the nerves. So you can imagine you having your feet, you're walking and you really can't tell if you mash a pin or a tack, you can't tell if it's there, right? Some diabetics actually go through that. I was fortunate, or not so fortunate, to meet, I had a diabetic patient, and she noted, you know, she had a problem with the toe. She noticed that the toe was swelling and she just didn't know why. The toe was just swelling. When I examined her, I realized that it was infected. And I looked below the toe, there was just a tiny spot there. I was like, okay, well, you know, let's send you for an x-ray so that we could take a closer look at what's happening. And when the x-ray came back, there was something inside of her foot. Something was inside of her foot. So of course, we had to explore the area a little bit to see what was there. And to my surprise, the length of the needle that was inside of that toe was really, really shocking. I was shocked, the nurse was shocked, the patient was shocked, because I kept pulling and I'm still pulling. And when I got it out, the length of the needle, and that needle wasn't there, it was a while, probably more than a week, 2 weeks or so, if I could remember clearly, right? But it's a good thing that she came in, that she noticed that something was wrong and she came in, because she could have lost her toe, right? So that's how it is. When I was studying in school, one of the lecturers, he coined a term called the tick-tock sign, where persons who had problems with the nerves in their feet, the diabetics, they would mash a tack, and the only reason they'll know that there was a tack there is because they will hear the tick-tock when they walk, right? So they just don't know. And that is another important reason for you to check your feet every day. Right, moving on to the next picture. Thick yellow toenails. Yes, if you notice changes in your toenails, that should also give you some kind of insight as to I should go and get this checked out. Of course, there are different things that can cause that, problems with your liver and so on. So it's good to get the doctor's opinion. Loss of hair on your toes, feet, and lower legs. Well, I spoke about that earlier. A fungus infection such as athlete's foot between your toes. So again, if you have yellowing or discolored areas in your feet, and itching, it could point to like fungal infections. Right? Of course, you want to clear that up quickly as well, because if your foot is itching, then you tend to scratch it, and then you could have breaks in the skin, which would be another route for infection. An ingrown for bacterial infection. An ingrown toenail or a sore, such as a blister, ulcer, or infected corn. Right? So anytime you see anything like this, the first thing to do is not just to run to the supermarket or to the pharmacy and get something to apply on it, like some of the plasters, right? You have to be very careful. So you need to get this sorted out from a medical professional, right? And as I'm on this topic, something I always say, I know it is a culture in Tobago to carry every injury, every open wounds to the beach, right? Please do not do that. That's a major recipe for more problems with your foot. Back in the days, people used to do it. The waters wasn't as contaminated as they are now. The waters are not very clean. There are a lot of different organisms in the seawater. And if you carry your wounds there, you end up with more infection, harder infections to treat, right? So be very careful about going to the beach with your possible ulcers to the feet or wounds. So now we're gonna deal a little bit with the veins themselves. So we're gonna deal with the veins and the artery and the nerves. You all are still seeing me, right?
Yes.
Yes, we are.
I had to shift my video a little down to get the entire screen. So once you all are seeing me, great. So now we're gonna deal with the veins. So some of you may have heard about the term venous insufficiency. It basically means that the veins are not functioning as they ought to, right? And this is something that diabetics can also experience, right? So if you look at the extreme left, there's the healthy leg, then you would see very small spider veins or very small vessels you would notice. Then the veins would become more prominent. Good. They will become swollen. Then you start to get skin changes. So the foot starts to look a bit dark. And especially around that area, just above the ankle, called the gaiter region, right? That is a very classic feature of somebody who has problems with their veins, right? Then you tend to have an ulcer that looking kind of healed. It's not really a fresh ulcer, and then it becomes more a very or open ulcer, right? So take a good look at this, because this is like the progression of what it looks like if you have problems with your veins, right, in the legs. And if you catch them early, then we'll be able to, prevent it from progressing to the ulcer, the stage of the ulcer at the end, which the further of a progress it is, sometimes it's a little more difficult or longer to treat, but still treatable. So let's move forward. Right, so if it is we have to deal with treatment of the veins, or if we have to deal with the veins so that we prevent any amputation, but it goes right back to the basics. Watch what you're eating. You have to get a proper diet. You must ensure that you follow what your dietitian says in terms of your controlling your sugar as well. You must maintain good sugar levels, because if it is your sugars are high, then your condition, any ulcers, any changes, it makes it more difficult for healing to occur, right? And many persons would say, well, I don't eat much sugar, I don't eat sweets, I don't drink solo. But then when you really get into what they eat, half of the plate is just rice. They may just have rice and chicken, no vegetables. They would eat a lot of dumpling, a lot of cricks, a lot of flour-based stuff, right? So the starches, you also need to be very careful because they break down to sugar as well, right? Exercise again. You can't get enough of the exercise, and especially for changes in the veins, the exercise is very important because it helps with the calf muscles, which help to pump the blood back to the heart. So with the damaged veins now, what happens is that the vessels, the valves in those vessels by the calf and the lower legs, they don't work as good. So the blood just pools down in the bottom of the leg and it doesn't circulate as it ought to, causing some of the problems that you have seen in the picture before. Weight loss, again, if you have more weight, is more weight on the legs, more weight on the body to help with the healing process. Elevate the legs. So for this instance with the veins, you can elevate the legs. So at night, you put up the legs on about 2 pillows, and most persons would say in the morning, they would realize that the legs are better. The swelling has gone down. However, throughout the day, as they walk on it more, they realize that they become swollen again. And that is because of the damaged the veins where the valves are what we call incompetent. Bandaging or compression stocking. So you may see some persons sometimes with some very tight bandages on their lower limbs, on their legs, as well as some stockings that are very tight that come up. Those also help to improve the circulation, right? There are other medications that can be used. Some persons are on things like Daflon. So Daflon also helps with the circulation, right? And of course, there is one of my favorites, hyperbaric therapy, having also being certified in wound care and hyperbaric therapy, right? It's one of the things that I advise for my patients. You know, a lot of patients, sometimes they would come to me and they would say, hey, they were given one suggestion and they just wanted a second opinion and they wanted to know about hyperbaric therapy and so forth. And so I would go through it with them. So what hyperbaric therapy basically is, for persons who don't know, it's really a chamber and it's situated in the Roxborough Hospital that patients go into, and high dose of oxygen is applied in the chamber, and that oxygen is what the patient uses. They would inhale the oxygen, and that high dose of oxygen helps to stimulate the healing, right? And hyperbaric therapy is good for all of these conditions that we are going to talk about, or that we are talking about today. Good. So that's hyperbaric therapy. Then there's the more surgical options, which should be things like venous stripping, where you can have the veins, the dilated veins actually removed, or you can have ablation therapy, where, you know, tubes are put into the veins and cause them to, and cause the healing of the large veins that are giving problems. So persons who would be best at doing this would be the vascular specialists, right? I know that there are some in Trinidad. I don't believe that we have any in Tobago at the moment. And also sclerotherapy is something else that the vascular surgeons use, where special chemicals are injected into the vein. So let's talk about the arteries now. So that was the veins. Now we're going to talk a little bit about the arteries. And sometimes, you know, you can have pain. Persons may notice pain when they walk, especially if they walk a certain distance. They would know after they walk this certain distance, they start to get pain in the leg. And that is called intermittent claudication. And it means you have some problems with the arteries in the leg, called peripheral arterial disease. And when it progresses, you tend to have what we call rest pain, whereby you're just sitting and you're having pain, or you can develop ulcers. Sometimes people develop gangrene, which is really those areas that you see looking black, where the tissues are dead because there's just not enough blood supply to the area. This is a special test that is done called the Ankle Brachial Pressure Index, or ABPI. Just to give you a little idea of what it's about, it enables the doctor to find out what is the severity of the disease arteries in the legs, right? So it basically involves applying a pressure to the arm as well as to the ankle area using a ultrasound machine called Doppler to check the flow of the vessel, and then you'll get different values that you plug into the equation, right? So one for the ankle and then one for the brachial pressure, both systolic values, which is the top number that you would see when you're usually doing your blood pressure. And if that's, when you do that calculation, you have a value between 0.9 to 1.2, then that's considered normal. If it's higher, then you can have probably calcified arteries. If it's less than 0.9, then you have peripheral arterial disease. And at that point is where you would tend to have things like the intermittent claudication, right? And if it's less than 0.5, then you have severe peripheral arterial disease. And in those conditions, you tend to have the rest pain, you tend to have ulcers developing, as well as sometimes gangrene or blackening of the toes, right? So if it is, you notice, you want to catch things early, because after, once it is you're under the 0.9, you may tend to have the pain that you would realize on a certain distance of walking, called the intermittent claudication. So you would need to get that checked out as soon as possible. So treatment, again, diet, exercise, weight loss, no smoking, all of those things all would contribute to, if you want to have some improvement. Medications in this case would involve things like cholesterol meds, because if it is you have high cholesterol, it tends to cause plaque within the vessels that would narrow the vessels, and therefore prevent the blood from flowing down to those extremities. Again, hyperbaric therapy. The thing is, if there is not enough blood flow to the foot, then the hyperbaric therapy wouldn't be as effective, because it's basically oxygen, using oxygen that's supposed to be carried by the blood to those areas. So if it is, we don't pick up the symptoms or the signs early enough, then things that are very beneficial, like hyperbaric therapy, may not be applicable, right? Again, the vascular surgeon comes in, where you can have things like angioplasty and stenting, which refers to the vessels, where they basically just open them up and allowing the blood to flow better. And then there's a bypass surgery, whereby, if a artery is already damaged, then they can divert the flow to around that damaged artery, so that another vessel carries the blood to the lower limb. And grafts are also done, where they can take a vessel, an artery from another part of the body, and utilize it in that area, so that it gives good blood flow to the lower end. Look at this picture. It's just a little comparison between the arteries and the veins, right? On the left, you would see the toes look very black, and that would indicate that this is a problem with the arteries, right? And below, if you look at what we would call the instep of the right foot, you're seeing a small circular area that's an ulcer. So that's an arterial ulcer. If you look at on the right-hand side now, right, we're seeing that discoloration just above the ankle, usually a darker area. That points to, and that's the gaiter region, it points to a problem with the veins, or venous insufficiency. And below that, there's actually an ulcer developing, right? So if it is, we can identify, you're seeing the darkening already there, then go and get it checked out, right? Because we can start preventing it from developing ulcers. Now we're gonna deal with the nerves. Yes, the nerves. And what are some symptoms that you can experience if there's a problem with the nerves? So neuropathy basically refers to a disease of the nerves, right? You can have numbness and loss of sensation. You can have burning and tingling in the feet, shooting pains and painful cramps, impaired balance, because if it is, your nerves are affected, and you're not feeling when you try to walk, you could imagine how you can have that feeling of being imbalanced as well, right? Deformities in the foot also very important. Some people miss that, right? So that's why it's good to know what your foot looks like, right? Because if it is you're not feeling, you don't have the normal sensation, then what happens is that you might be walking on someplace very hot, someplace very cold. You might be walking on something that is chucky, and you just can't tell. And you can be putting unwanted pressure on areas that you're not supposed to, which would ultimately cause a deformity in the foot. The bones may be shifted. I mean, you're really not sure until it really gets obvious, right? Which is when the foot is already deformed. And we'll talk a little bit more about that. And then, of course, hot and cold sensitivity, as I spoke about. Right, neuropathic ulcers. So the neuropathic ulcers tend to occur more on those pressure points below the feet. So if you look at it, that's the area that is usually touching on the ground. So take a look at it. So when you see ulcers around that area, it tends to be more neuropathic in nature. And the good thing about neuropathic ulcers is that the blood flow is usually very good. So they usually have very good blood flow. So even though there are ulcers there, they are easy to treat. Once it is, you relieve the pressure from off of those ulcers. And there are certain things that we will see further that would help do that. So this is what I was hinting to just a while ago, where you have the deformity of the foot. If you look at the bottom left, that's a foot that is deformed. And especially for a diabetic, this is very problematic, because if it is you don't put the pressure where your foot is intended to get it, then you get all kind of deformities with the bones, and ulcer formation, infection being a risk as well, right? And many persons who develop what we call the Charcot's foot, if not treated, they tend to end up with amputation. So you need to be very mindful of any deformities in your foot, especially if you have diabetic neuropathy, where you're not having that sensation in the feet. Because what happens is that you continue to get trauma to the area, to the ankle and to the foot. The foot becomes deformed, and then it leads to bad ulcers and potential infections. Good, so you're seeing the normal foot at the top. That's how the foot is supposed to look. Note that lovely arch in between, where we will call the arch below the foot. Good. But if you look at the Charcot foot, then you would notice that there's a drop instead of a raise just in the middle of that foot, which is the point where would cause ulcerations most of the times, because the bone is pushing down on that thin tissue, and then your foot is also, that is the part that your foot now takes the pressure when you walk. So how do we treat this? Again, diet, exercise, weight loss, compliance with your meds, right? Medications. There are certain medications that help. Things that, like some that come to my mind, things like gabapentin, and there are some others, right? Those are the medications. But very important is your footwear. Very, very important, right? The footwear, and there are things like different kinds of boots and casts, which I will show in the other slide. Again, hyperbaric therapy. And in some first world places, and even some places in Trinidad and Tobago, there's nerve stimulation and acupuncture that is done to help relieve like any nerve pain in the lower limb. Right, so these are some footwear that help to take off pressure off of those areas or those ulcers that might develop in the pressure points below the foot. So the first one is a total contact cast. Sometimes you might see a person with a cast all the way up the whole foot. It's not that they have a fracture or any broken bone, but they may have actually a neuropathic ulcer, right? And this cast basically, and these different footwear, they shift the pressure from off of that ulcer to help the blood flow to help stimulate the healing, right? So the total contact cast is one that you can't remove. So the patient stays in it until the foot is healed, right? Of course, they will have visits with their professional and so forth to ensure everything is going okay. And then you have different boots and different footwear. These ones can be removed, but the patient has to follow instructions and be very compliant. If it is they're taking it off, it's not to go and run and all of those things. They still have to be able to to prevent the pressure from the ulcers, right? Those boots, they have special padding and so forth, so it doesn't apply pressure to the ulcer below. Right, and I've been talking so much about hyperbaric therapy, so I did get some actual footage from patients in Tobago who had hyperbaric therapy at Roxborough, right? Some of them I would have referred myself to hyperbaric therapy, right? If you look on the extreme left, that is a person with a diabetic foot, right? Also turned into, which would have been debrided as well. Person also had some toes removed, if you notice, earlier on, right? And after hyperbaric therapy, and these sessions, sometimes they range from 15 sessions to 30 sessions or more, depending on how the healing process is. That's what the foot was after a certain number of sessions on the right. So it does work. And this would have been this looks like it could have made, sometimes you can have mixed problems with the vessels or the nerves. So this looks like it could have been mixed, probably arterial mainly, right? But the hyperbaric has helped this person to not have any further amputation. And look at this person. So this person has an arterial ulcer, yes, and after hyperbaric therapy, that's their foot on the right. So she was very happy. And this now looks more like a neuropathic ulcer. Yes, and again, if you look on the right, after some sessions, it has been completely healed. A very extensive wound here. Yeah, this looks more arterial. If you look at the foot, you'll see it's very dark. Here, the hair is sparse and the foot looks a bit dry. Yeah, so this looks more arterial. Yeah, there could still be some mixed venous component, but it looks more arterial. And look at it on the right. Yeah, after hyperbaric. And of course, these are just photos that would have been taken at any point in time, but they would have been followed up for completion. I don't have the final photograph for all of the pictures. So this just shows that the hyperbaric therapy works. It works for the veins, it works for the arteries, it works for the nerves. Right? This is somebody else here. This is clearly venous, right? The area above the ankle. If you look at the left, it was very, very dark. There were also some ulcers developing as well. And on the right, after hyperbaric therapy, the foot looks much better. The ulcers will heal. The darkening has been less. And very happy patients in the end. So having said all of that, I just want to reiterate that if it is you've taken all the precautions, or for instance, you may have already had an amputation, it's not the end of the world, because we do have a lot of information, a lot of technology, a lot of medical staff and support for you, right? So from the family and the community providing support. I know family, I was listening again to the person who was speaking, and family support becomes very important. The medical team as well is always there, ready to assist the nurses, the doctors, nutritionists, occupational therapists, physiotherapists, social workers, and the mental health team, and everybody else who plays a part, right? There are foot and wound care specialists as well. And the Diabetic Foot and Ankle Clinic, we have that as well that we can use. There's the idea of prosthesis that persons can get as well. And just today I saw on the news that the government is going to get about 800 prosthetics from India, I believe it is, right? So that's a good step for persons who would have already had an amputation. Of course, there's the Tobago Amputee Support Association doing a great work, and through the church facility or church services, there are groups just like AHPA, Adventist Health Professional Association, and other medical groups from different churches that would also play a part in educating the public or lending assistance to persons, right? Counseling through the church, and of course, a spiritual upliftment is very important. With God, all things are possible. I mean, going through something like this, you must have a good relationship with God to carry you through as well. I think that would carry you a very long way. So we can't just throw the spiritual aspect to the side and only work on lifestyle measures. So in summary, the diabetic foot amputation is a main complication of diabetes or diabetes mellitus. Uncontrolled diabetes is a major risk factor. We don't want our sugars to be uncontrolled. We want to get them within normal levels. Added conditions like obesity, high blood pressure, and high cholesterol, if untreated, increases the risk for amputation. Avoid smoking and alcohol. Amputation can be prevented with good foot care, a healthy lifestyle, compliance with your meds and your follow-ups, and early action. When you monitor your feet and you notice any changes, you immediately seek assistance. And remember, support is always available. So these are my references. I thank you, and I hope you enjoyed and you learned something from the presentation today. So if there are any questions, I can take them at this time.
Right, Dr. Chadband, thank you so very much for the information. We will first look at the chat. Anybody else have a question? Just click the raise hand icon and I'll get to you, or type it in the chat, right? The first question I says, hi, good day. Can I have more information on type 2 diabetes? That's from Mr. Samaru. Mr. Samaru, that's a type 2 diabetes has such a long topic, big topic. You probably have to be a bit more specific in the question so that we will know how to answer it, unless Dr. Chadband has an idea of what he wants to tackle with that.
All right, well, with type 2 diabetes, remember the problem with diabetes really is a insulin problem. So with type 2 diabetes, the insulin in your body really is not functioning the way it should. And therefore, your sugars tend to be remaining high when after a certain period of time, they should be coming down. And persons, therefore, they have to make certain changes, which they start with their diet, they start with exercise, the lifestyle changes are always first. And even if you start medications, you must continue lifestyle changes. So the smoking, the drinking of the alcohol, all of those things you must stop, as well as if it is you are overweight, you need to cut down on the weight. All of those things would help to make the insulin your insulin work better, and also to help prevent you from progressing to a more uncontrolled state, right? Persons with type 2 tend to be on medication, tablets, but if it progresses, then you could also be on insulin. So I hope that has helped you in some way. As Dr. Waldron said, it's really a wide topic.
All right. Next question. Can a client with venous ulcer use a compression stockings or socks over their dressing?
Over the dress, but it depends on what the ulcer looks like. If there's a lot of swelling and stuff, then yes, compression stockings can help. But there are some persons who don't have all of that swelling, they may have the ulcer, and therefore you just need to do the necessary treatment The dressings are usually 3 times a week. In many cases, the arterial ulcers and the venous ulcers, they tend to take a little while to heal. But once it is you go through, you do your checks, you ensure your sugar is well controlled as well. Taking medication, you don't want the sugar too high. Because remember, even if you use compression stockings and you're doing your dressings and all of that, if the sugar remains high, then the healing process is hindered. So we need to ensure first and foremost that we get good sugar levels, right? You need to have someone who knows about foot care doing your dressings. Some persons stay at home. Sometimes they apply their own herbal remedies and stuff at home. I'm not opposed to herbal remedy, but for things like this, we need to be a little more cautious and we need to have a health provider check the wound, right? So you can have your dressings at the health centers. If you want to do things privately, that's an option as well. And of course, there's the wound care departments and other specialists who can help, right? And they usually too, based on the extent of the wound or what's the presentation, they would either suggest adding stockings or altering medications and so forth to help with the healing. And of course, hyperbaric, don't forget hyperbaric therapy.
All right, and well, you mentioned it could take a long time, and the client we interviewed was over a year of regular dressings before the ulcer had healed. All right, next question. Could you have arterial and venous insufficiency in the same leg? I think that came out in the presentation. Yes, you can. What part the drug Jardiance 25 milligram play in diabetes treatment?
Right. So, well, that is one of the medications that you can use to reduce your sugar levels, right? So just like things like metformin, there's that type of medication as well. And for some persons, they see better results on it. There are some persons who, for instance, they can't use the metformin because they may get gastrointestinal side effects from it. Some people, not everybody, they may feel a little, get some bowel motions, they may feel nauseous, and therefore there are other medications like the Jardiance that they could use to help control their sugar levels, right? Of course, again, the basic is what you eat, do your exercise, right? Lifestyle measures come first and then medications after.
All right. How many meals should a diabetic eat in a day?
That's a good question, but that is something that you should also take up with your dietitian or your nutritionist. There are some diabetics, for some reason I chat with them and I ask them, have you seen a dietitian as yet? And some of them tell me no, and it just can't work like that. You must see your dietitian so that you get a very good insight of what you should eat, how much you should eat, and when you should eat. But as a diabetic, you need to eat before you take your medication, especially if you're taking insulin, because you don't want your sugar levels to be already low because you didn't eat. You take the medication and the medication is intended to decrease the sugar level. So then it can drop too low and you can have problems like blackouts. You can have, even if it is your sugar drops too low, you can have a heart attack. Yes. Yeah, if your sugar drops too low. So that's how important it is. So that's why we would say to eat, have something to eat and then take your medication, right? I had a patient just recently who told me that, I just only eat once a day because I doesn't feel hungry. Now, this is a person who is on insulin. She's on insulin. This is a person who was not compliant. She takes the insulin. However, she wants to tell me, I just adjust my medication to suit, right? And she also didn't come to clinic for an entire year. Over a year, my anxiety was through the roof. And I was like, no, and I had to counsel her because I looked back in the notes and I didn't see any blood results. And I'm thinking, no blood results for at least a year and how many months? And I was like, no. So I had to really, I gave her a good counseling. I told her what she needed to do, that she needed to eat because she can't be taking all that insulin. And it wasn't a little bit of insulin because she was uncontrolled. So she was on a good bit of insulin, morning and evening. And she was only eating breakfast. And she came telling me, well, no, sometimes she don't feel good. She just be lightheaded sometimes. And I'm saying, well, hey, you could be having what we call hypoglycemia, where your sugars are dropping very low, and it's very dangerous because if you drop too low, you can go into coma and all of these things, right? So she was very grateful for the advice. I sent her for urgent bloods, and I told her what they need to eat. At least if you want to eat twice a day, because that is when you're taking your insulin, you had to have something to eat. You can't just eat in the morning, right? Yes, I hope that gives you some insight as to how you should eat.
All right, next question. My sugar levels during the day is within normal limits, normal levels, but the fasting sugar is above what is recommended. What can I do to improve these readings?
Okay, so if it is your fasting sugar is high, then we probably need to look at what you're having in the evening. That could be an issue. I'm not sure if the person is, did you say she's taking meds? Well, once you take the meds as you should. But I've had patients like that already before. And something that I noticed, they said, well, I don't really eat nothing big in the evening. I just have a few cricks and then I go to bed, right? And the cricks, as little as you think it might be, it break down to sugar. And for some diabetics, these things can really cause spikes in the sugar. So maybe you need to look at what you're having for dinner and see if that could be part of the reason why you're having this spike in the morning. Of course, exercise as well. If you're lacking the exercise, then you might not have that good of a control as well.
All right, which is better, oral medicine or insulin? I heard one said to eat more normal. Insulin seems to be better.
Ooh, well, even better than those two is a healthy diet and exercise and avoiding all of those other things we spoke about.
That's correct.
So we don't want to, and that's what I keep going back to the basics, because that is what is really the important aspect. Yes, you may have to take medication or insulin if it is, you still need that boost. But even if you're on those, it doesn't negate the fact that you're supposed to be eating properly. You're supposed to be exercising. You're supposed to be, try to maintain a good weight, avoid smoking and secondhand smoking. So not because you're not smoking, you sit around a whole group of people that puff and smoke. It affects as well from secondhand smoke and so on, right? But it's not just about which one is better. Based on, as I said, based on your levels, your sugar levels, and based on how well your values are monitored, then you may start on just the oral tablet. And then for persons who we realize, well, the insulin is just not enough, it's just not working, then you would need to have the insulin, right? So it's all about the function as well. How well is the insulin functioning in your body? If there's insulin being produced in the right quantities and so forth. So it's not just about which is better, all right? It's based on you. Each person is different, and through it all, basics, maintain the basics.
All right, and just to add that, so lots of people, when you are on insulin, it's because you are far along in the disease process. All right, so the better thing is to try to avoid it altogether by doing what you need to. Next question, what are some strategies you can use with a non-compliant client who insist on doing their own thing?
Ooh, strategies. Well, certainly you're not going to bog them up with some tape. and force them to do it. Now with diabetes, there's a mental aspect as well. You know, some persons, I know they are diabetics, so they are ashamed that they have diabetes. They don't want any people to know. They may be depressed for whatever reason. Maybe they are trying. There are some persons, they're really trying, they're making an effort. Yeah, but their values don't seem to be coming around, right? And so they tend to be depressed. There are different reasons. And I think that if you listen, I tend to listen to my patients. I tend to hear them out, because many times what they tell you would help them to make a change in what they are doing. But if it is you just want to tell them, hey, this is where you have to do, you're not doing it, then it creates a barrier between you and them, and it makes it even more difficult for them to become compliant. So I think you need to first understand what is happening with the patient, because there may be a lot of things happening behind the scenes. Is it that the person is the breadwinner and they lost their job, they don't have the finances to probably to get the vegetables or to eat how they want to eat, and it's not everybody who might be able to plant. I know we tend to say it, well, yeah, plant your own thing, but not everybody may have the space to plant. Not everybody may be able to be a good planter. There are some persons who are just gifted, because there are some persons who they would try things and the crops just don't come. So we also have to keep that in mind as well, right? So I think that for the non-compliant patient, it's very important to hear them out, to understand why they are non-compliant, because it might be a simple fix. Maybe the person has a problem with transportation and they're not able to get to the clinic, right? And if funds are low, they might not be able to travel. So there are certain things that might be able to, we might be able to discuss and come to a common ground to help them to do better.
All right, and the final question we have for this evening: what is the purpose of spironolactone 25 milligram in diabetes treatment?
Spironolactone in diabetics. All right, that one, I would have to do a little research on. Yes. But I know, you know, with diabetes, you tend to have, some persons have different conditions with diabetes, right? So it may not be that the spironolactone is just for the diabetes. Maybe it's to also assist with some other medical condition as well. But that is something that I would have to do some further studies on for you.
Right. So for me, spironolactone is used in general in heart failure, right? And we know a lot of diabetics also have other heart disease. They also have heart disease, and they also have hypertension. And so spironolactone is one of those medications that may be used. So that's where I know it from in terms of that aspect. I don't know of anything specific for diabetes wise, which I don't know that one. All right, so I think if I'm thinking correct, it's more to do with heart failure rather than with diabetes itself.
So one other thing, now persons who have disease of the lower limbs, particularly peripheral arterial disease, where the arteries, that's where the arteries are affected, they may also have different problems. So that's why it's good to go to the doctor, because you may have different symptoms that might be possibly pointing to problems with the heart or even to the brain, right? And when you go to the doctor would also ask certain questions or do certain exams to make sure that they treat the entire patient. Because if you have problems with blockages in the lower legs, you could also have blockages at other areas, right? So that's why I tend to tell patients, no, don't just stay home. One patient tell me, well, she good. She don't have no problem. She feel good. And I said, feeling good is not enough, because that patient had high blood pressure, diabetes, they had high cholesterol. And she said she would just buy her medication. She don't come to clinic. I just buy it and take care of myself because she feels good. And I'm telling her, no, there are persons who feel good. And then someday you hear, you know, so-and-so drop down the road. And that's what happens. That is what happens. Yeah, because they're not following up. It's not good to not have a medical check. At least if it is, you know, you do your checks once a year at least. I mean, you could get a follow-up. If it is you have problems identified, then the doctor would usually bring you back sooner. Diabetics usually sooner, right? So these are things that we tend to take lightly that we shouldn't. And diabetics are people you need to be a little bit more cautious, as we said, in all the different areas that we spoke about. And there's help. And once it is you have the knowledge, you'll be able to know what to look out for, when to have, you know, medical advice. And you know that there are a lot of persons behind you waiting to support you.
All right. Thank you so very much, Dr. Chadband, for all the information. So I see many persons said thank you on the chat. You could also use your reaction and give Dr. Chadband a clap or thumbs up, whatever reaction you want to give, just to say thank you, Dr. Chadband, for all the information and for your time. All right. Very good, because we had lots of information and he spoke so much on diabetes, and we're more leaning towards the amputation side, but we got lots of information from the diabetes, right? So thank you very much, Alemayu. Before we go, we're gonna our next AHPA. So this month is unique. We have two AHPA healing platforms in 1 month because we had postponed from the last week in August. So this day is August 1. So at the end of September, we'll have September's information. And I saw Miss Nash, you still on, so that you can tell us if you have a topic for us at the end of the month.
Yeah. Hi, good evening. Thank you so much. And thank you, Dr. Chadband, for that excellent presentation, quite thorough, detailed, and relevant for our diabetics to understand. And for our topic in September, the last Sunday, yes, Trinidad AHPA will be hosting. And we're looking at nutrition in prevention and reversal of disease. So nutrition in terms of prevention and reversal, and that too will be quite interesting. We have Dr. Patricia Diet, who will be our presenter for that session. Thank you.
All right. Excuse me. Thank you. Sorry about that. Thank you very much, Ms. Nash, for that information. And it will tie in beautifully with what we discussed today with diabetes and avoiding amputation. So we look forward to seeing all of you on here. We had more than 70 devices logged on. So we look forward to see as much or more joining us next week. So before we go, sorry, not next week, at the end of the month, last Sunday of this month. Let's have a word of prayer before we dismiss. Heavenly Father, we thank you for the information that we gathered here today. We thank you for Dr. Chadband being willing for us to glean what he has learned and what he has for us. May we not just listen, but maybe apply what we've learned, and may we tell someone else so that they too can find a knowledge that can lead to healing. And as we return here in a few weeks' time, may more of us come, may of us log on as we learn and as we heal from our diseases through your grace. Just as I pray. Amen. All right, so thanks everyone for joining. All right, so you're free to say bye-byes, and we'll see you at the end of the month.
Thank you, Dr. Walton and Dr. Alemayu.
Thanks for
Thank
the
you.
invitation. Thank you to the team. Have a blessed night, everybody.
Thank you for the information. Have a blessed night.
All right, blessed night. Good night.
Thank you. Very informative. Thanks for the information, Dr. Chadband, was well received.
Thank you, doctors. Well received information. Well to apply. Thank you so much.
Bye. See you guys next time.
Bye.